Hi, this is Dina Nebley with New Jersey Family Magazine, and with us today is Dr. Jason Minion, pediatric psychiatrist at Atlantic Health Systems Atlantic Medical Group. He's joining us today to talk about a topic that's been on all of our minds as parents as our kids go back to school in person for the first time in a very long time, and anxiety is growing. Dr. Minion, thank you so much for joining us.
Thank you, Dina. I really appreciate the opportunity to have this conversation.
We really appreciate your time. I wanted to start with the types of issues that you're seeing with patients generally, and then I wanted to ask you whether you anticipate an increased level of anxiety in kids as they get back to school for the first time in person in a very long time.
Sure. So yeah, I see kids ranging from about 5 to 21 years of age for a whole host of issues. Primarily, actually, anxiety disorders are probably the most common in about half of the kids that we see. Also some depression or other mood disorders. ADHD and behavioral problems are quite common, especially in the younger kids. Also see some kids with autism, as well as working at a program specific for eating disorders, so see a lot of that there. And I am anticipating for most kids to have, of the kids that I'm seeing at least, to have an increase in anxiety as the school year starts off. They just came off of a very strange school year, and this year is supposed to be somewhat a return to normalcy, but now with a lot of question marks. I think there are also some kids that will do far better this school year than last, as they're able to return back into the school and into somewhat of their normal life.
Yeah, that's a hopeful sign, because just being there in the building, I think, is helpful to a lot of kids to get that sense of normalcy back. But how do we begin as parents? It's kind of a big topic, but as we see that anxiety, how can we begin to help our kids? What are the kinds of things we should be saying or doing?
Yeah, so I think a lot of it is just monitoring and looking out for that anxiety. We don't want to necessarily expect it to always be there, and so kind of forcing the kids to feel our own anxieties, but checking in with them, letting them feel, I think, safe to be able to talk about what they're feeling and share your feelings as well. Can be helpful for families to have maybe time set aside to discuss what they're feeling, maybe at a dinner together, whatever can be arranged. And you know, when starting to see signs of anxiety, it's important to take steps and things that we might talk about parents can do, but seeking help as well when it seems to be getting more extreme and starting to cause more problems in the child's life.
And that's when you probably need to go to the next steps, talk to your pediatrician, and talk to an expert.
Yeah.
In general, what about just that transition of being in a building? That specifically, there are a lot of kids who have been in the building and they've been going hybrid or full-time, but there are some who've been only remote, and it's their first time in a building, in many cases, a year. What about that very specific transition?
Yeah, so I think in these kids, a lot of what might help is just setting expectations and you know, talking to the kids about that, asking, you know, are they worried about it? What specifically are their fears? And not asking this to try to solve every problem they bring up and make them feel like their worries aren't you know, valid worries, but to be able to listen to what's actually on their mind. Can also help to share if parents are experiencing the same worries, to let the kids know that they're not alone in feeling this way. Sometimes when we're anxious, we start to think that no one else is experiencing the same thing, and that makes it feel worse. And being able to practice, so if there are buildings you can take the kids to, like maybe the supermarket, or and if you're part of like the Y or some club, you know, somewhere you can go just to experience that again. And being able to see, you know, that it goes all right, help ease the kids into it. Can even talk about scenarios of, you know, so what do you expect it to be like, and start to think this through. That way in our mind, in the kids' minds, they've already gone through entering a building again, and that might help them to feel safer as they actually return for school on that first day.
Those are really helpful, especially the listening. I tend to talk a lot when I'm anxious with my kids, so I think that's so valuable. We know anxiety reveals itself in so many ways. It could be a stomach ache, a headache, could be excessive visits to the nurse. Can you tell us some of the ways that we should look for, signs that we should look for that our kids are more anxious than we realize?
Yeah, I think that's actually a very important point to recognize that anxiety doesn't just come out as someone saying, I'm feeling anxious or I'm scared, but so often it is in these physical manifestations. See a lot of kids with a lot of, as you say, stomach aches and headaches. Chest pain is another thing that gets felt a lot, or feeling heart racing or trouble breathing. A lot of times with these conditions too, the kids feel like it means that they're dying, and it might lead to emergency room visits or visits to the doctor. And it is somewhat important to make sure that there isn't something else going on. I mean, kids can get stomach aches for so many reasons, but knowing that anxiety can be one cause. And along these lines, when you're talking to the kids about that, I think it can be important to not send the message to them that this is anxiety and therefore you're faking it or it's in your head, because because they really feel invalidated about their emotions and then won't be able to work through the anxiety as well. So the way I often present it to kids is that when your stomach hurts, it's really your brain is what's experiencing the pain, and it's telling you it's coming from the stomach. But when you have anxiety, the anxious part of your brain might tell the other part of your brain that you're feeling stomach pain. So you're feeling it just the same, but the source of it is different. We also know that anxiety can amplify the feelings that we're otherwise having. So often we're feeling so many things all the time, and our bodies have to choose to ignore some of these feelings, or else it would get overwhelmed. I mean, you're touching your clothes, the ground, your hair is touching your face. And so when you're anxious, though, your brain isn't as good at shutting down a lot of these feelings and ignoring them. And so if you feel a little bit of stomach pain and you're already anxious, that might then get amplified and you really focus on it. And the more you focus on it, the more you feel it. And so you can let kids know that, right, they're feeling the pain, but the anxiety is what's making it feel this bad.
That's a really excellent way to explain it and kind of break it down for our kids so that they realize, there are ways that to recognize it truly and be able to deal with it. On that note, I wondered if you could share tips for talking to kids that are more age appropriate. Our viewers have kids as young as preschool all the way through high school, and obviously the way you talk to them would vary by age. Do you have tips around that?
Yeah, and a lot of it probably varies also by kid. Parents, hopefully you know your kids and know what their level of ability to understand the situation is. But that's important to keep in mind, and you don't necessarily want to lie about anything or cover things up, because kids can generally tell maybe better than we think when we're not being truthful, and that would probably increase their anxiety. But still providing with age-appropriate facts about the situation. Especially a lot of the younger kids and preschool kids are hopefully not watching the news. They don't really have the ability to understand the context and the details of what's going on, and that often leads to more anxiety. And so some of it can even be asking the kids already what's their understanding of what coronavirus is and what's going on in schools. And then be able to address the points that they bring up. I imagine a lot of parents have had some conversations about this over the past year and a half, especially as they're trying to teach their kids to wear masks. The questions must come up.
Yeah, that's true. And what about when you really just don't know? One final thing I wanted to ask you, when you just don't know what your kids are going through, a lot of them don't open up. And they could seem fine, and really they're just really anxious, and there are no visible physical signs. They're not talking to you. So do you have any strategies to help our kids, help us as parents, help our kids open up about those words?
Yeah, that's also a good point, that so many times the kids may either just feel embarrassed about it or feel like it makes them more anxious to talk about it. And so as I've said, that sometimes they think they're the only one going through it, and so don't want to share that. So certainly if you get the sense that this might be going on, or if you just want to assess, it can help to set up just time that's designed to talk. So maybe have the whole family get together and say, we're going to share a bit of what we're experiencing, and you can lead by example. Kids, whether consciously or unconsciously, will often model what they're seeing in adults and in other people. And so if you can, as a parent, sit there and tell a kid some things that you might be worried about, or things you're looking forward to, or your expectations, it can encourage them to share as well. There are some kids I know that I've seen that want to share, but have trouble to put it into words or feel difficult to do it through talking. And so some families have found having like an open journal to be helpful. And so not necessarily a private journal for the kid, but something they'll write in that they expect their parents to read as a way of being able to start the conversation. That probably tends to work better in some of the older kids. Some teenagers will be just very resistant to engaging with their parents for anything, and might have spent a lot of the past year alone in their rooms. I think that population can be more difficult to reach if they're closed off. But again, just being open, let them know that you're there to listen, not to judge their anxieties or try to, again, kind of interfere. That can often help them to eventually feel comfortable. Sometimes it also takes, and maybe parents aren't the best people to hear this, and going to pediatrician, that might be a place that the kid feels more comfortable opening up and given some privacy there.
That's a really good point about the pediatrician. This has been so helpful, and we really appreciate you taking the time to join us. And on the note of the pediatrician, if a parent has a concern, should that be the first step?
Yeah, there's pediatrician is probably a good first step. Someone who can talk with the child and evaluate the situation. They're trained in assessing for anxiety. It's one of the more common issues that show up to a pediatrician's office. They can help make referrals to a therapist if that's appropriate, or make referrals to a psychiatrist if that's needed. They can also do some of the management on their own and continue to follow the kid. Usually, the pediatrician is also someone that's known the child for some time, and so there's already some relationship there that helps to figure out what's going on and help find solutions. When parents are also already in school, it can be, or when the kids are already in school, you can even talk with teachers. There might be things that they're noticing happening in the school environment that the parents don't see at home or aren't aware of.
I really appreciate you taking the time. And on the note of what you said about where to go and pediatrician, I wanted to add that for additional information, you could go to atlantichealth.org/kids behavioral health for more information. Again, thank you for your expertise and your time, Dr. Minion. We really appreciate it.
Sure. Thank you.
Thanks for joining us.